Milieu therapy, the therapeutic community. So milieu therapy is part of the conditions necessary for a therapeutic environment. So the psychiatric mental health nurse provides structure, maintains safe and therapeutic environment, or milieu. So in a nutshell, milieu therapy is a scientifically structured environment that affects change and improves psychological and function of the mental health patient. So within this environment, the client is expected to develop or learn adaptive coping skills as well as interaction and relationship skills. So the current focus of inpatient psychiatric care has changed. The emphasis on acute hospitalization length of stays now average 2 to 3 days. Some basic assumptions of milieu therapy. So the health of each individual is to be realized and encouraged to grow. All individuals are considered to have strengths as well as limitations. Every interaction is an opportunity for therapeutic intervention. The ideal situation exists for clients to improve communication relationship development skills. Learning occurs from immediate feedback on personal perceptions. The client owns his or her environment. The client should have the opportunity to make decisions and solve problems related to the environment or the milieu of the unit, and have personal autonomy as well. Each client owns his or her behavior and is responsible for his or her behavior. Peer pressure is a useful and powerful tool. Behavioral group norms are established through peer pressure. Feedback is direct and frequent so that behaving is a manner of acceptable to other members of the community becomes essential. Inappropriate behaviors are dealt with as they occur. So what I failed to mention on the previous slide is that Skinner has 7 basic assumptions. And so I went over the first 5 and I began the 6th one on the previous slide. So these are Skinner's basic assumptions of milieu therapy. All right, so number 6, which I began on a previous slide, inappropriate behavior are dealt with as they occur. Individuals examine the significance of their behaviors, and look at how it affects other people, and discuss more appropriate ways of behaving in certain situations. And number 7, restriction and punishment are to be avoided. So destructive behavior can usually be controlled with group discussions. However, if an individual requires external controls, temporary isolation is preferred over lengthy restrictions or other harsh consequences. So let's talk about conditions that promote community. So containment. So the environment is contained to create a sense of safety and security. So that's a common theme for our psychiatric nursing or our mentally ill patients. We want to make sure they are safe. Structure. So the environment needs to have a structure that promotes goals of treatment. So our patients should have scheduled activities, group therapy or individual therapy, but they should have a routine, right? Where they have certain um, activities and certain boundaries for our patients. 3 is involvement. So the environment should encourage involvement. We should have community, social communities, common dining areas, small group seating arrangements, community meetings. So we don't want our patients secluded, withdrawn, and off to themselves. Support. So the environment must be supportive and affirming rather than rigid and punitive. So And with support, you want validation. So the environment must support and affirm the needs of the individual, both within and separate from the community. So an active, empathetic, listening ear should be available. The program of therapeutic community. So care is directed by the interdisciplinary team or IDT. Initial assessment is made by the psychiatrist, the nurse, and other designated medical health professionals, and they establish a priority of care. So the IDT determines the comprehensive treatment plan, goals, therapy, and assigns interventions and who's responsible to carry out those interventions. All members sign the treatment plan and meet regularly to update the plan as needed. So we have ourselves a question. Which of the following best describes the role of the psychiatric social worker as a member of the interdisciplinary treatment team? A. Provides ongoing assessment of a client's mental and physical condition. B. Functions under the supervision of the psychiatric nurse. C. Serves as a leader in the treatment team. D. Conducts individual, group, and family therapy. And we did not necessarily talk about this, so make sure you read your textbooks. But I'll give you a second to take an educated guess. And you are correct. The answer is D. The psychiatric social worker is a member of the interdisciplinary team and conducts individual, group, and family therapy. The role of the nurse in the milieu therapy. So the nurse assumes responsibility for management of the therapeutic milieu on a 24/7 basis. Nurses have the responsibility to make sure the patient is receiving their psychological and physiological care. So, additional responsibilities of the nurse include medication administration, developing a trusting one on one relationship or rapport with your patient, setting boundaries or limitations, letting them know what is acceptable or unacceptable behavior, and educating your patient. And we have ourselves a question. A client diagnosed with borderline personality disorder approaches the nurse's station often in various requests. The nurse intervenes by stating, "You may approach the nurse's station only once an hour." Which nursing intervention has been employed? A. Providing reality orientation. B. Ensuring physical need fulfillment. C. Setting limits on behavior. D. Providing client education. And I'll give you a second. And you are correct. The answer is C. In this situation, the nurse is responsible for setting limits on unacceptable behavior in the therapeutic milieu. Consistency in carrying out the consequences for violating the established limits is essential if learning is to be reinforced. So she set boundaries.